We have one more speaker before the break, Mr. Eric Tanis. He is an organ recipient. He's a patient. We all have been patients, but he is a patient who has very kindly agreed to share his experience with the world of healthcare with us, and we really greatly appreciate his willingness to come and speak to you all today.
Good afternoon, everyone. Thank you, everybody, for having me here today. My name is Eric Tanis. About 6 years ago, January, I had a liver transplant at the University of Chicago Medical Center. I've lived in Brooklyn now for about 2 years, and I got a lot of things to say about insurance. So the whole thing about getting to Brooklyn, my wife and I were living in Gary, Indiana, where we both grew up, which is right outside Chicago. And between Indiana and Illinois, there's a state line that's a giant wall in terms of insurance. So the reason that I had my liver transplant was because I drank. I drank for a long, long time. And we were kind of in a rut. We had both just turned 40, and I kind of had said to her, we're dying here. We got to get out of here. And we'd always talked about coming to New York, and that was always something that we were going to do. And, we turned 40, and it's like, if we're not going to do it now, we're never going to go. We're going to get too old. And so we made the preparations. We started doing the groundwork. She quit her job. I worked with my father in a men's clothing store business for, my entire life. But he turned 65, and he was going on Medicare. So he said that the health insurance costs for me alone would be too expensive and that I should just decide what I wanted to do. And I said, well, I'm going to be gone in a couple of months. I'll just go without. So both of us now are uninsured. This is summer of 2018. We get to December, early December of 2018, and one day I'm getting ready to go to work. And overnight, my color had turned. I was just almost green. And my wife looked at me and she said, you have to go to the emergency room right now. You just look terrible. She called the nurse. She said, she's telling me that your liver has failed. You have to go. And I looked at her and I said, if we go to the emergency room, we don't have insurance and it's going to bankrupt us. She said, I don't care. We're going to go. We're going to go. So on that morning, we went to our local hospital in Indiana. And I had had a prior incident at that hospital before where I had a very bad detox where I spent almost 3 weeks in there. So they had given me a stern warning. We don't ever want to see you in this hospital again. Never come back like this. If you do, we're going to die. Well, I came back uninsured, pretty much at death's door. And they really didn't want to do much to take care of me. My wife was able to get us a policy through the Affordable Care Act while I was there drying out in the local hospital. But basically they were, we're going to churn you out. We're going to send you home. We're not going to give you a referral to a transplant. We're not going to do anything. One of the doctors actually said to me, you have the choice. You can die here or you can die in your own bed. So decided that was not what we were going to do. So we went home, we stayed the night, and we thought about it. We took the drive to the University of Chicago the next day. Got in through the ER, and they saw, how I was. But obviously I had this history with alcohol, and we were struggling with insurance, obviously, too. So it was a real challenge because, I was very, very sick. I had a MELD score that was, I think, in the high 30s, almost 40. And I didn't have a whole lot of time left. So we had to deal with the two-pronged front of dealing with convincing the hospital administrators that I was worthy of getting a transplant. I had tried unsuccessfully for a long time to quit drinking, but everybody says this is the time they're going to do it. But I was sincere. I was really sincere because once that I looked at myself in the mirror. I said, there's no coming back. If you don't get through this, you have no choice. So if you do get through this, you have to stop. And frankly, it was a pretty big relief. So we spent the next 6 weeks in the University of Chicago basically defending me to both the insurance and to the hospital, you know, and we had to say, I have worth, I have value. There is something to be gained by giving me access here to this scarce resource. You know, I'm going to be a good steward of it. So we had a lot of people that were on our side. We had a lot of people that were very skeptical, but ultimately the hospital agreed to, you know, okay the transplant, but it had to get the approval of the insurance. So that was a big hurdle, and we were really, really happy about that. But the insurance kept saying no because I had this recidivist behavior. You know, I had this big black streak against me from the first time. And we're going through the appeals process. We're going through and through, and we get to late January, and we're down to our final appeal. And it's a Thursday night, and my doctor comes into the room, and she says, I want you to gather the family tomorrow morning, 7:30. And we know what that means. You know, they're going to say no. So I call my parents and tell them that they have to come into the city to see me. And sometime around, I don't know, 6, 7 o'clock that night, this Thursday before the meeting, my wife gets a phone call. And she takes it in the hallway. And she's gone for a long time, and I don't know who she's talking to. And she comes back, and she says to me, that was the weirdest phone call. It was someone from the insurance company. And he had your file on his desk. And he just started asking me questions about you. And I told him what was going on. He didn't say anything. He didn't make me any promises. He didn't, whatever. We just kind of talked. And we didn't really think anything of it. So the next morning, you know, about 6:30, 7 o'clock, the doctors and the nurses start stirring, shift change. And there's something in the air that's not right, you know, and everybody's kind of buzzing, and they're talking about new tests being ordered and faxes being sent. And my doctor comes in, and she says to me, we don't know what's going on. Just hang on, you know. So what happened was sometime between that night and the following morning, the Friday morning, the man from the insurance agency changed his mind and said that the insurance was going to cover the transplant. So that day, I got put on the transplant list. The following day, I got matched with a donor, and the following day, I was in surgery. And I got out Monday after. So from Thursday to Monday, I went from basically dead to alive almost overnight. And you know, I've told this story a lot over the last 6 years, and you know, I told it a lot in the first year, and then I kind of backed off telling it for a little while because it made me a bit uncomfortable, you know, and say, hey, you know, the reason I got my liver was because of alcohol. And you know, the pandemic, you see a spike in people like me, cases like me, and I realized that it was kind of selfish not to share what had happened with me. And I think it's important, you know, what happened after the transplant with the insurance was really the most challenging part. So the hospital agreed basically to carry the freight for the first year because there were so many issues between Indiana and Illinois. And they wanted to make sure that I was viable, and they wanted to see me through that first year. So I had all my coverage, all my tests, everything I did in Chicago. But then when that year ended and I had to go back to coverage in Indiana, it was absolutely nightmarish. We could not get even the most simple things done. Everything was a bureaucratic nightmare. In the original writing of the policy that we had used to get the transplant, they made a huge mistake, and we ended up with something like a $30,000 bill because they didn't take the tax credit correctly. So by that first year, everything's good, I'm healthy. And then all of a sudden we got that dropped in our lap, and we had to fight that, we had to appeal that, and that was days and days and days and days on the phone. And that second year, they wouldn't cover anything. I would get my blood work done, and basically my doctors would see it in Chicago. They would call me in Gary and tell me what to do, but I never saw them. I was never able to see them in person. They wouldn't cover a visit, just even to see them. There was an irregularity in one of my tests, and I needed a biopsy on my liver. And that turned into a thing where nobody knew if it was approved or not when I had it done. And basically the doctor said, we're going to make sure it's okay. Don't worry if they send you a bill, we're going to go through this. And everything turned out fine. Unfortunately for me, I received a wonderfully matched liver, and I've been incredibly healthy ever since. But the biggest stress in all of that was really dealing with the insurance that second year. You know, getting healthy was fine, we did that, and then between that and then COVID coming and not knowing if anything was ever going to be covered if I got sick, what I was going to do. And I did get COVID, and I had no idea where I was going to go. And it was a big deal, and they sent me to this hospital 50 miles away from me in Indiana. They said that was the only place that would take me and to give me the antibodies at the time. And it was just a nightmare. And more, I noticed what was going on in our state. They were stripping away rights. It started with reproductive rights. But you could see what was happening. Indiana was just going to take everything away. They were looking at Chicago and they said, we do not want to be like that. That is, you know, the opposite of what we're going to be, and we're going to make our brand on that. We're going to pull everybody's medical rights away. And they did. And I saw that happening. And so once I started to get well enough and COVID had ended enough that it was safe, I told my wife, we still have to get out of here because I can't stay here. You know, we'll never be able to be safe here because I'll never get the treatment that I need. And now I've been here 2 years in New York, and my medical team it's at NYU, and it's phenomenal. Everything that I need has been taken care of. I don't worry about that. And the simple fact that I don't have to worry about that is such a relief. It's the mental component of being well. You know, getting past 5 years with a transplant was a huge milestone. And now I can look forward to say, okay, you know, next is 10, and we can go 15, and we can start looking out, and we don't have to look over our shoulder all the time to think that there's just going to be something that's going to grab you by the ankle and pull you back down and say, oh, you know, if this goes wrong, we're sorry. You just can't be covered. Those state lines were just, they might have been, it was like a prison, being locked in. I mean, I could be in Chicago from where I worked in 15 minutes by car, but I might as well have been on the other side of the world. It's remarkable to me to have this gift that I've been given, and really to have the opportunity to speak in front of you and kind of share where I'm coming from and know that I would like to make an impact however I can. Everybody's story is unique, and the transplant process is so challenging. And I started sitting in with a caretaker group on Zoom, and you see what these people are going through, that they stay on the wait list with their spouse or their partner or their family member for months and years at a time, and they wait, and you know, some of them have to wait through dialysis and all the other kinds of illnesses that come as you just wait, and you wait, and you wait, and the scarcity, between the scarcity and the hurdles. To go back to the presentation about cost, you know, I mean, what it cost us in time and effort on the phone and all these just man hours to do something simple like get a test done. It's still unbelievable to me. You know, and I have this complicated relationship with insurance because I have someone who sat in a room in a state where I don't know where he was. I still to this day don't know the man's name. And this man basically made a decision to change my life. He saved me. You know, between him and the hospital, I owe my life to those people. And I hope someday to get a chance to thank him, but I also want to say, hey, you know, did it really have to be so hard? You know, couldn't there have been an easier way to do this? If you were just going to say no, and don't drag it out and make us go through this whole thing. Because I had accepted not getting the transplant. I was very comfortable with that at that point. I mean, I was very close to dying, and it changed my perspective for the better, but really nobody should have to be at the mercy like that to come out with a clearer head. And I'm here today, I'm sober, and I'm healthy, and I'm in a place where I want to be, and things are very good for me right now. And, you know, I survived, and I know that the system is in a lot of flux right now, and I just hope that anybody else going forward doesn't have it as difficult as I had to. You know, I know I made a lot of self-inflicted mistakes, but there were a lot that could have been avoided too. So anyway, thank you for the invitation, and thank you for letting me speak. Thanks.
Thank you so much. Thank you so much, Mr. Tanis. Really appreciate you sharing this really personal, just at times nightmarish, in your own words, story. It really means a lot. I'm sorry about what you had to go through at the kind of and the insurance-induced paranoia that it brought you. But we appreciate you sharing your story. I'll reiterate what you said about yourself earlier, which is that you have value, you have worth, and it really means the world for you to be able to come back and kind of tell your story. So thank you.